Good morning and welcome to today's Here's to Your Health podcast and video. My guest today is Dr. Andrew Mayo. Dr. Mayo is with St. Croix Hospice, and we're very pleased to have him with us today because November is Hospice Awareness Month. And Dr. Mayo, thank you for joining me today.
Well, thank you so much for having me this morning, and excited just to share my passion of hospice with you, especially during National Hospice Month.
Before we begin today, maybe we should start and have you tell us a little bit about your background, about your medical background, and what you've been doing with St. Croix over the past, I guess, what is it, 10, 12 years?
Yeah. So I ended up in medicine largely due to my family history. My great-grandfather was one of the Mayo brothers, and that sort of drew and piqued my interest in medicine. My great-grandfather was a physician. My grandfather was a physician. My father's a physician. My brother's a physician. And so I kind of followed in the family footsteps. But what really drew me into hospice, I was in family medicine for 18 years in St. Croix Falls, Wisconsin. And what really drew me in is I started moonlighting in hospice, providing hospice care and coverage on my days off. And I started to appreciate that team approach to care. And when I look back at what my ancestors had done, what made the Mayo Clinic great was really the fact that they appreciated that it took a team to care for a patient. And the Mayo Clinic was the first multi-specialty group practice in the world. And so when I started seeing this team approach being applied in hospice, it struck a chord in me. I knew it was something that I wanted to do. So in 2014, I started working full-time with St. Croix Hospice as their chief medical officer, overseeing the medical directors of St. Croix Hospice and also caring for people in hospice along with a team.
So let's start at the beginning. And you talked about a team approach to hospice, which I think is a wonderful thing. But I don't want to assume that everybody knows exactly what hospice is. So why don't you tell us first, what is hospice?
So hospice is care that's provided to a person who has 6 months or less to live. And what hospice is, it's a specialized care, a palliative type care that provides a patient with the best possible quality of life. And so the focus at some point in time during a chronic illness turns from being curative to being palliative in nature, taking care of a person's symptoms.
Okay, so keeping that in mind, tell us a little bit about how hospice actually works.
So it comes down to a person when they're at a point in their chronic illness. A lot of times people think hospice is just related to cancer, but many other diagnoses can be is very common. Heart failure, chronic obstructive pulmonary disease, neurological conditions. When a person recognizes, and their physician recognizes that the focus is no longer on fear, but on having the best day possible, living as best as one can with the time that they have remaining. That's when hospice comes into play, and to be part of that continuum of care for the person. It allows a person to no longer to have to go into the hospital or go into the emergency room. Their symptoms can be managed where they are, wherever they call home, be it in a nursing home or in a
So we talked about a team approach. Who would the team members be who would actually be a part of that hospice team?
Yeah, so it consists of the patient's primary care physician, hospice medical director like myself, a nurse, and really a team of nurses that can cover a hospice aide, a chaplain, a social worker, and then different types of therapy, volunteers, physical therapy, occupational therapy, music therapy, pet therapy in some instances as well.
And volunteers do play a role in all of that hospice care. Can you describe for us a little bit about how that works?
Yeah, so the hospice benefit, as outlined by Medicare, actually requires the participation of volunteers, and they come into a person's home and provide companionship, and also, allows other caregivers present in the home to be able to do some self-care as well for themselves. Certainly with coronavirus 19, the volunteer component is not as robust as prior to coronavirus, but we're hoping, soon, now that we have vaccinations in the near future, that we can start resuming some of those services.
In conversation with people, and I hear this a lot, people will say, well, so-and-so just went into hospice, or some other person just went into hospice. I think one of the things that's somewhat mystified me, and maybe there are others who share the same question in their minds, who qualifies for hospice? How do you know that a patient is ready to become a hospice patient?
Yeah, that's sort of the crystal ball. And it can be a little daunting for some people, because I think one of the barriers to being ready for hospice is the sense of, am I giving up? And that comes from both the side of the caregivers and the medical team, but also on the side of the patient and the family. And the reality is that we all have a finite lifespan. And when we're dealing with chronic illness, the further and further we go along in that chronic illness, the less time that we have left. And someone who qualifies for hospice has an expected life expectancy of 6 months or less, based on the judgment of a physician, and really two physicians. But how does that work in reality? In reality, what happens is people typically wait far too long before thinking about getting onto hospice. The average length of stay for a person on hospice is 17 days. And when you think about this as a 6-month benefit, it clearly shows we need to start thinking about hospice earlier. And hospice doesn't take away hope. Hospice focuses on hope for living the best day possible with the time that's remaining. And so one of the ways that is very simple for people to think about is a would I be surprised question. And would I be surprised if this person who I care about or am caring for, would I be surprised if that person were to die in the next 1 year? And if you say, it's not something I want to think about, but I wouldn't be surprised based on the fact that they've been going back to the hospital repeatedly, emergency room visits, then that's a person to think about at least talking about hospice, or having a hospice come in and talk about whether or not they're eligible. Because that's how the hospice referral typically works. It's somebody saying, hey, let's think about hospice. And then it goes back to their physician and says, hey, Mr. Jones is thinking about hospice. Do you think that they have a life expectancy of 6 months or less? And oftentimes that's yes. And then hospice and the team can come on board and walk alongside that person, walk alongside their family, and focus on providing them the best possible life with the time that they have remaining. And that entails covering their medications that are related to their terminal diagnosis, covering all the hospital DME, the beds or the commodes, any equipment that they may need that's related to that diagnosis is all covered by hospice, and providing care that comes into them wherever they call home, be it at their home, at an assisted living, or at a nursing home.
My guest on the podcast and our YouTube video today is Dr. Andrew Mayo. Dr. Mayo is the Chief Medical Officer for St. Croix Hospice. We're talking about National Hospice Month and hospice awareness, and I really do appreciate your time today. I just have one more question that I wanted to follow up with, and it came to me while you were talking about the 6-month process of being on hospice. Sometimes I think people worry about how am I going to pay for hospice? And you mentioned earlier that Medicare and Medicaid have a process for that. And I think just to allay some fears about whether or not, hospice care is covered by insurance. Could you speak to that for just a moment?
Yeah, absolutely. Part of the reason that hospice is a hidden gem, vastly underutilized, is that the cost of hospice is totally covered by Medicare, Medicaid. Most private insurances and VA benefits all have a hospice component to it. And there's no cost out of pocket for the patients in regards to those services. And a person has been paying, for this their entire lives, as long as they've been contributing to Medicare. It's a benefit that they're entitled to. And, the one thing that I never hear is, I wish I had waited longer to get onto hospice. Most people get onto hospice and they say, I wish we had known about this sooner. We should have signed up so much earlier.
Dr. Mayo, thank you so much for your time today. We really appreciate it. My guest on the podcast and on our YouTube video today has been Dr. Andrew Mayo. Dr. Mayo is the Chief Medical Officer at St. Croix Hospice, and we appreciate his time because we're talking about National Hospice Month and hospice awareness. I'm Don Luensmann, Executive Director of Marketing and Development at Crawford County Memorial Hospital. We care for life.